Hello, everyone. We are so excited to be with you here today. My name is Amber Nichols.
And I'm Blake Matthews, and we are AmeriCorps Volunteers in Service to America, otherwise known as AmeriCorps Vistas. As AmeriCorps Vista members, we have made a one-year commitment to work on a poverty project here in the City of Billings. Our commitment has been with the City of Billings Community Development Division, working on the Coronavirus Response Initiative project. And through this project, we've been tasked with gathering community feedback regarding the COVID-19 pandemic, as well as mobilizing resources to better serve the low-income populations here in Billings. This is the foundation year for this particular Vista project, meaning there will be another Vista working towards these goals in the next year. Before we begin, Amber and I would like to briefly introduce ourselves before we share a bit more about the COVID-19 data that we've gathered as part of this project.
So I was born in Helena, Montana, and I moved to Billings when I was in high school to pursue pre-professional dance training. After graduation, I moved out to Seattle to dance both collegiately and professionally. However, I was injured pretty shortly after I got there and entered into an early retirement, the ripe age of 18. I then transferred over to Seattle Pacific University's pre-med program, and I graduated from SPU last spring with a degree in applied human biology. I chose this position with AmeriCorps not only to be closer to friends and family in Montana, but also to give back to a community that certainly did a lot for me when I lived here. After my service term, I do plan on going back to school and pursuing a Master's of Science in the History and Philosophy of Science, followed by PhD work in a similar vein.
Hello again, my name is Blake Matthews, and I grew up in a small town called Davidson, which is approximately 20 miles north of Charlotte, North Carolina. I've grown up and spent most of my life in North Carolina and actually attended the University of North Carolina at Chapel Hill, where I graduated with a Bachelor's of Science in Public Health. After graduating in May of 2020, I wanted to move somewhere new and very far away from North Carolina, and also do anything that I could to help out with the ongoing coronavirus pandemic. This is how I ended up here, over 2,000 miles away from home, working on the Coronavirus Response Project. After my service term, I hope to work in a clinical research position, as well as attend medical school in the fall of 2022.
So today we will be sharing with you the steps that the City of Billings Community Development Division has taken to wisely allocate our CDBG-CV funds. Now, CDBG-CV stands for Community Development Block Grant Coronavirus. The City of Billings was a grantee of just over $900,000 of funding through the first and second Federal CARES Act allocations. You'll see here on the bottom of the screen a simplified timeline of the CDBG-CV allocation process. Now, in order to best highlight how we've identified service gaps in this community, we will be focusing on the first three steps of this timeline today, those being community assessment, report publication, and establishing priorities. So to gauge how our community had been affected by COVID-19, we conducted large-scale community assessment using two surveys, one for community members and one for service providers. Paper copies of the community member survey were distributed via city water bills in September and October of 2020 to over 33,000 residencies across Billings. And while this did reach a huge proportion of the Billings population, it did miss anyone who didn't get the bill in the mail, which includes the majority of renters, as well as our homeless and transient populations. So to increase the accessibility of the survey, Blake and I took to the streets, and we hand-delivered the survey at the Southside Gardeners Market. We coordinated with local healthcare groups, rental agencies, the Housing Authority of Billings, now known as Homefront, and other social service providers to distribute the survey. We also advertised the survey around town using flyers, and those had QR codes on there to make taking the survey that much easier from your phone. And by these means, we distributed an extra 2,000 surveys. In total, we had 3,512 respondents complete the survey, which was about a 10% response rate. And as for our service providers, we assembled a mailing list of area providers using the Montana 211 guide from United Way, as well as the resource notepad, which was created by a former Vista. We mailed the survey to 70 providers and followed up with each of them via phone or email, and this generated a 37% response rate with 26 providers responding. Now, you may be thinking that these response rates are not very impressive. However, in the last citywide National Citizen Survey conducted here in Billings, we had just 395 responses. So we are so grateful for the residents of Billings for participating in our survey and helping us identify the service gaps that do exist in our community.
So I'll now touch on our process of report publication, as well as a few relevant data demographics for our community member survey. Once all surveys were accounted for, Amber and I began to outline, analyze, and draft our assessment report. Our work was consistently reviewed by community development staff members, Tam Rodier and Brenda Beckett. And in December of 2020, we finished our first draft of our assessment report. Community development board members were also constantly involved throughout this process as they received report drafts as well as preliminary result presentations. In January of 2021, we published a draft of our report on the City of Billings website and opened it up for a 30-day public comment period. After this period, we published the final and current version of our report on the City of Billings website on February 9th of 2021. For the demographics of our community member survey, we had 1,464 community members identify as being low income and living within the Billings city limits. HUD guidance on the CARES Act funds lists that all activities funded by CDBG CV funds must primarily benefit low-income individuals. Following HUD guidance, we focused our report, as well as this presentation, on this population only. Therefore, for the rest of this presentation, if you hear any statistics regarding this community member respondents, they will be referring to this population of low-income and local respondents and this population only. With that, at least 53% of this population identified as being aged 62 years or older. The average household size was approximately 2, and therefore the total number of represented individuals by this population was approximately 3,000. The breakdown of the identified race of these respondents is shown here on the left. As you can see, this very closely resembles Billings census data, which lists Billings citizens as being 90% white, 5% American Indian or Alaska Native, and 5% other.
So in establishing priorities for CDBG CV spending, we took into account not only the feedback we received from the surveys, but the spending guidance set in place by Housing and Urban Development as well. So according to HUD, all CDBG CV sponsored activities must first exclusively prevent, prepare for, and respond to coronavirus. Second, prevent the duplication of local, state, and federal services. And third, primarily benefit low-income individuals. So you'll see here on the bottom of the screen the categories of greatest needs as reflected by survey respondents. And now once we take into account HUD guidance, particularly that second stipulation of avoiding the duplication of services, these are the priority areas that we can address. For service providers, needs include increasing the capacity to provide virtual services to clients, increasing telework capacity for employees, and increasing an organization's ability to facilitate social distancing. For community members, needs we can address include computer and internet access, food security, mental health, and utilities assistance. So focusing first on virtual needs relating to computer and internet access were widely reported among both community members and service providers. Nearly a third of our service providers indicated that their greatest need was increasing their capacity to provide virtual services to clients. And the majority of providers indicated their clients had been impacted by not having a computer, tablet, or internet access in their homes. For our community members, just about 30% reported having less access to reliable internet than they needed. And also to note here is that the majority of community members were unaware of the Stay Connected grant and the telework assistance grants, which were available through the state of Montana. And we will be chatting a bit more about awareness of services just a bit later in this presentation.
Food insecurity appeared to be a major theme throughout both of these surveys. As seen here, the vast majority of our service providers reported that their clients had experienced a decrease in food security due to the pandemic. And when we asked a similar question to our community members, we had 1/5 of respondents report a lack of food or groceries due to the COVID-19 pandemic. Now, you may be wondering why there's such a large difference in percentages between our service providers and our community members. And one possible explanation could be that the clients in which these service providers are reporting upon were actively seeking aid and assistance for their situations, whereas our community members may or may not have been. Moving forward, we did a cross-analysis of the community members who did report a lack of food or groceries, and we found that 3 out of every 4 of these respondents had at least some knowledge of or were currently using the food bank and food pantry assistance resource.
So questions about mental health were asked directly on the survey, and many respondents also chose to elaborate on this topic in free response questions. Nearly 70% of our service providers indicated that their clients did not have access to mental health care. And for our community members, increased stress since the start of the pandemic has been widespread, with just about 40% indicating they had less access to mental health services than they needed. One question asked community members to indicate their degree of support in categories like taking a break, and for this category, nearly 30% of respondents had no support.
Both our service providers and community members reported difficulties regarding their utility payments. As seen here, the majority of our service providers had reported that the pandemic had affected the ability of their clients to keep their utility payments current. When we asked a similar question to our community members, approximately 1/5 have replied similarly. Now, I would like to draw your attention here to the bottom half of this slide, where we'll talk a bit more about employment and income loss. If you recall, with HUD guidance, all activities funded by CDBG CV funds must prevent the duplication of local, state, and federal services. As it happens, there are services within the City of Billings that are addressing employment and income loss. However, Amber and I thought it would be important to mention these statistics from our report, as income loss may easily overlap with the ability to pay necessary expenses such as food, internet access, and utilities. Employment and income loss was the #1 overall reported pandemic effect by both our service providers speaking on behalf of their clients and our community members speaking on behalf of themselves or their households, with 88% of service providers and 34% of community members indicating this.
So after reading through the feedback and analyzing thousands of surveys, both Blake and I were surprised to see how many respondents had been adversely impacted by the pandemic, yet were unaware of the services available to them in Billings or through the state of Montana. This graph on the right shows the percentage of respondents who had some knowledge or were using the services listed below. And as you can see, the majority of respondents had at least some awareness of the food bank and food pantry assistance, whereas only between 20 and 40% of respondents had even some knowledge of the other 5 services listed. We also asked respondents to indicate their involvement with public assistance, both before and after April 1st of 2020. 34% of respondents report using assistance before this date, and 22% of respondents report use after this date. However, these numbers may not necessarily be mutually exclusive, meaning someone who is using assistance both before and after April 1st may be included in both numbers. Now you may be thinking, shouldn't more people have been using public assistance at the height of a pandemic? Shouldn't that second figure be larger than the first? Well, due to a discrepancy in survey wording, that 22% may very well indicate the number of novel applicants who applied for assistance after April 1st, and may not reflect in totality the number of community members using assistance here in Billings.
So, in conclusion, the priorities that we've discussed throughout this presentation will be considered in allocating CDBG CV funds to all applicants and reflect the input of the Community Development Board. Giving attention to these categories of utilities, food security, utility assistance, and mental health will help our community better prevent, prepare for, and respond to the coronavirus in very meaningful ways. Ways that you've seen not only our community members have given their importance to, but our local service providers as well.
And again, these priorities have been established using both survey feedback as well as the spending stipulations set in place by Housing and Urban Development. And while it may not be a priority per se, increasing awareness to the services that address these needs may be important to our community going forward, given that survey feedback reflects a general lack of awareness of the services available here in Billings and throughout the state. I'd also like to touch on the importance of addressing service gaps even as we move beyond the COVID-19 pandemic. As we begin to see the light at the end of the tunnel with lifting restrictions and readily available vaccines, it may be important to consider that these service gaps existed before the pandemic. They were of course exacerbated by the effects of COVID-19, but they will continue to exist post-pandemic without intervention. And when service gaps exist in our community, we experience a lack of resources and our basic needs may not be met. And without basic necessities like reliable internet access, there may be a decreased awareness of services, or residents may be unable to seek them. And when residents do not connect with service providers don't receive feedback, and they may not be able to mitigate the service gaps that exist, thus perpetuating this disruptive cycle in our community.
So to date, the City Council has approved allocations to the Salvation Army to expand upon their mobile meals service, and to the Downtown Billings Alliance Business Improvement District to install a public restroom facility with a hand washing station in the heart of downtown Billings. City staff is currently exploring other opportunities to prevent, prepare for, and respond to the coronavirus. This may include additional opportunities to apply for CDBG CV grant funding, in which the City Council would consider at future meetings.
And last but not least, we would love to share with you what we've been doing since report publication to address a few of the needs communicated to us by survey respondents. My first project is called the Pandemic Pals Project, and this is a letter writing campaign that connects K-8 students, seniors, and community volunteers with the hope of increasing pandemic-safe socialization and decreasing loneliness, especially among our elderly residents. And to date, we have over 350 participants. My second project is the COVID-19 Resource Guide, and this guide compiles COVID-specific resources into categories like healthcare, childcare, and food security, and it has so far been distributed to state agencies, local organizations, and it's also available on the City of Billings website.
My project has been an uplifting video, which I call Happy Notes. And this stemmed from reading through so many surveys with much ado about social isolation and just overall negativity, as well as moving to a completely new place myself during the height of a pandemic and experiencing many of these things personally. I wanted to create a video that would help shine a light on a more positive perspective of the pandemic. And I've done so through interviewing many of my fellow Vista members, as well as different community members throughout the City of Billings. My hope is that when people see this video, they feel a sense of community solidarity, some joy, and they can reflect on the pandemic in a more positive way. Amber and I have also been coordinating with local partners to bring COVID-19 vaccination clinics to low-income and vaccine-hesitant populations here in Billings. The Downtown Billings Alliance has provided gift cards to give as an incentive to anyone receiving a vaccine. And to date, Amber and I have helped vaccinate over 75 individuals, and we really hope that this number continues to grow. You can visit the links on the screen to learn more about our report or the projects that we've just discussed, and definitely stay tuned to learn more about these exciting activities developing within our community. Thank you all for watching.